So you've talked at length about task prioritization as an emergency medicine physician, but I mean, I think you were gently prodding me towards one of the more I guess more fascinating things that you've done that I also mentioned in the introduction, gridlocked. Tell us about that.
Mhm. Yeah, so I went to do my thesis. I published a paper about, why, like why and how people don't flow the department and how they learn to do that, right? So like there's a paper called Failure to Flow, which is looking at all the trials and tribulations of teaching and environments and how we don't always give learners a chance to actually flow the department. So how do they ever learn, right?
Yeah.
We did look at um, a study that talked about managing multiplicity, understanding like the cognition of how people actually navigate multiple patients and how they actually do all that stuff. And lo and behold, like you said, there's an expertise that's required. And my analogy would be when you handle multiple patients, it's like you spend a good chunk of your training learning how all the chess pieces move.
Mm.
And then only then, after you understand how every piece moves, then you can start playing chess, right? And so it's just that in the emergency department, if you think about the patients like chess pieces, that you need to anticipate their movements and really you're trying to understand how everything's going to flow and fit. Well, there's just a lot more chess pieces and there's a lot of permutations. And so you start to then create these archetypes of patients that then you can your head chunk them in some kind of anticipatory story to say, okay, this is a middle-aged female who likely doesn't have chest pain, but is really worried about her chest pain being something bad. And so that phenotype becomes a story that you tell in your head about what needs to be done for this patient and how long that's going to take and who's going to be involved in that patient's care. And you have like all these scripts there in your head
So
about that,
wild.
but there's a functionality to it. So that's how people learn how to balance multiple patients is that they know each of those patients as some kind of phenotype, some kind of story in their head, and then they're just playing with the pieces. So that's the next paper. Then we actually did a follow up on how we coach in this chaos and how actually teachers do survive and what strategies they do use to be able to teach people how to handle multiple patients. And after those three studies, we realized a big chunk of what was missing about prioritization and teaching that is that there was no safe place for a learner like yourself to be able to engage in that thinking and learning that skill because the only way that we have right now to do it is probably either a massive simulation, which costs so much money, and we can do it every other year in our residency program, or and that's only once that you can do it, and really only one person can be in charge, and so it's going to take a long time or a lot of money for everyone to do that. Like, or we could be thinking about other low cost, low budget opportunities to be able to do the same thing. So we created GridLocked. And so GridLocked was a knowledge translation project that takes all the learning from my thesis and tries to create a platform for people to then teach and learn about multi-patient environments within a safe, really simulated, but it's a serious game environment that's more analogous to what healthcare and municipal leaders often engage in, something called tabletop exercises for disaster preparedness. Not something like the pandemic. So there's, there's a board game about the pandemics, obviously, but uh, but it's actually like, for instance, if we have a nuclear reactor in on the McMaster campus, and so the idea would be, okay, so what happens if something goes wrong? And then we do drills and exercises about how we would respond to that. What would fire do? What would the police do? What would the hospitals have to prepare for? What other military and or governmental agencies have to be involved? And they do these simulations. It's kind of like Model UN for like healthcare providers and like, municipal leaders. And so they do those quite regularly. And so we thought, well, shouldn't there be a sorry, shouldn't there be a tabletop simulation for the emergency department? Because isn't every day sort of a little bit of a disaster, right? Because we're, even before the pandemic running at, 105%. And so it's never an optimal situation. And so understanding how we can do that is important.
Hmm.
And so that's why the gridlocked board game became a thing. And so we co-designed that with a bunch of, well, they're senior residents now, but they were medical students at the time. And one of them's an attending now because he did family medicine. And so we co-developed that with 3 faculty members and 3 medical students. And then we got into production. We're the 4th medical student the next summer, and and we got going.
Honestly, that sounds a lot like either Diner Dash or Overcooked, but for an extremely hectic healthcare setting.
Yeah, a little bit. I mean, what it is that if you've ever played the game, what happens is we take the medicine out of it. And so the medical students learned a lot about medical management because what they did was they created cards where the patients have needs that they have to be met by the different interprofessionals team that's represented in GridLockED. So you have a staff doc, a resident, a bunch of nurses, 4 nurses, um, a radiologist who is really more a cartoon character that stands in the place of the entire radiology department, and then a consultant who role plays basically every consultant. We had to do some abstractions, right? Because I didn't want to give like people like 13 different consultants to sit around not doing anything. Um, and so that's basically what the Gridlocked is about. And so what ended up happening is that we um, you actually place the different healthcare providers in different rooms, and when they're in the room, they can actually check off actions within each of the rooms to take care of the patients in those rooms.
hmm You had mentioned off the air that those who weren't so medically inclined tended to perform actually better than some medical learners. What do you think that is?
Well, I think that it's about suspension of belief. And so it wasn't actually learners that we had trouble with mostly. It would be career physicians closer to the end of their careers who didn't have a lot of simulation experience.
Mm.
We have trouble with these slight abstractions. They're like, well, that's not exactly how it works. And I'm like, okay, okay, but it's a game. And so we do have to make some decisions and decrease the complexity a little bit because otherwise it'd be a simulation. And then we talk a little bit more about the game. And I know you're laughing, but like fidelity is something that, you know,
Yeah, yeah, that's
is
fair.
important, right? And so this particular thing looks at fidelity not from the system's point of view, but in terms of the understanding of the dynamics of flow. And so once you actually zoom out enough with some of those faculty members, they got it, right?
Mm,
They understood that, but they couldn't get over that hump at the beginning. But I'm like, just play, and then you'll see.
mm,
And then by the end, they're like, oh, I have a little bit of PTSD. This is like every shift I've ever like experienced.
mhm, mhm,
And then that's when the conversation gets to start, right? Because if they realize that by playing this game for an hour, they can replicate an entire shift's worth of decision making and thinking, then isn't this a powerful tool to be able to help a learner understand that without exposing, 60 patients maybe to any undue harm by having a first year resident run the department? That's just never going to happen, right? And it's not safe. But in an emergency setting where we have a game that actually emulates all of those decisions, you could let them play. And then you can let them play again. And then you can let them play again. And you can give them feedback each of those rounds. And by the end of playing 4 games, a high school student understands, actually, it's not even 4 rounds of the game, it's like 4 turns of the game. We played this with high schoolers. By turn 4, if I recorded the audio about their decision making and placed it next to a bunch of attendings playing and next to a bunch of residents play, I defy you to be able to differentiate which group was actually talking. If I gave you an audio clip, I don't think you'd be able to tell the difference.
that's fast.
They were talking like emerge docs.
So, I mean, if this tool is or this game tool, if
Mhm.
it's so impactful, like what has the scope of its adoption been? And if the adoption hasn't been as wide as you've expected, why hasn't it been adopted as widely as you would have thought?
I think it's been adopted pretty widely.
Hmm,
I mean, it's niche because it is more for emergency medicine
got it.
providers. It is niche because it's based on the Canadian system. So again, if you have a fidelity issue,
Fair enough.
then you might, oh, it's not American enough, right? Like, fine, right? But we've sold like, I don't know, I believe it's over 500 copies worldwide. Like, it's a popular game. And we get sales in like Europe and Australia. Like, it's all over the world. And you can check out like the feedback from some of our fans when you follow our game has its own Twitter account at GridLockED. Um, and it interacts with its own fans.
Shameless
And
plug.
so there's some people that actually do engage in it, and some play with their kids because as an immersed doc, you probably can't do what my dad did and take your kid to work. This is a great surrogate for that, to be able to explain. hmm And so the idea would be that um, I know at least one precocious 7-year-old who fell in love with the game so much that before her dad went to work, she would wake him up and say, "Can you play the game before you go to work?" And he'd be like, "I have to go to work today." And he didn't really want to, but he did. And so it emulates things, and like, you get to see some of the reactions. One of my friends, Seth Trigger, live tweeted the game, one of the games that he played with his daughter after they set it up. And his commentary is pretty funny. He's like, "T.Chan, this game knows how to hurt me," because he drew the gridlock card, at an inopportune moment when the consultant was up taking care of a code, and then they were gridlocked, and then, like, nothing could move. And he was like, "This is so eerie. This is exactly what happens to us all the time." And so, and he reported that his daughter quite liked the game. Yeah.
Those are some amazing stories, and I definitely am gonna go out and buy the game now. But I guess apart from what's the future of the game? Goose just walked through the screen. Um,
It's all good. I don't think our listeners can hear that, so it's okay. Well, the GridLockED game has spurred a prequel game. The prequel game is called Triaged, and Triage just won an International Serious Games Award, and so in the academic category. So Triage is about what you do if you're sorry. Triage is about what you do if there's a field disaster and you're the incident command person, and usually those are paramedics at a scene of a small disaster. And so you actually draw a card, or it's like a disaster, like a burning building or plane crash or whatever, and then you start the game. And the game has you draw um, basically cards that are characters who have experienced a mass casualty incident, and then you have to triage them correctly and send certain of those patients to the right hospitals. And so there's different hospitals in the game, and you have to basically get people to the right hospitals and things like that. And so that's the idea. And you learn very quickly when you play this game why we get something called code zero. At least that's what we call it in Hamilton, when there's no ambulances available in the system to be able to take emergencies to the hospital, because they're all sitting at the hospital waiting to offload the patients. And so that's the point of that game, is to really teach that. And so it placed first as in the academic category at the gala competition this year, which was hosted in Italy,
Mhm.
but it was an international online conference. So that was pretty cool.